How can the country improve its genome testing and sequencing to get results faster? To answer this, we have with us Dr. Eva Maria Cutiongco-De La Paz, Executive Director of the UP National Institutes of Health. Evening, Dr. De La Paz.
Good evening.
Ma'am, before we get to what we should do, let's try to understand first what's our current situation. Ano nga po ba ang capacity natin for genome sequencing and what can we do to improve it?
Yeah. So thank you for that question. And I think this needs the public needs to know to be clarified about our capacity to do genome sequencing. So we do have at the Philippine Genome Center, where I also serve as health program director, we can sequence 750 samples a week. We can increase it further to about 1,500 samples a week if necessary. We can also do some small runs using other machines, like 300 samples or like 25 samples at a time to address some special concerns about clustering of cases. So the whole point is, I think, that we need to do is the question really, do we need more sequencing or do we need to be smarter in selecting the samples that go into a sequencing? As you all know very well, not all RT-PCR positive cases are included in the sequencing. There are some eligibility criteria that we use to screen, like including like the CT value of an RT-PCR sample, a positive sample. We are only able to do good sequencing if the CT value is 30 and below. And then, of course, we prioritize which ones that go into a sequencing among the RT-PCR positive cases, like international incoming travelers, 2 spikes or surges of cases, 3 would be like clustering of cases, and 4th would be those presenting as more severe or like causing death in many cases. So there is a way that we can be smarter in selecting samples for the sequencing.
Okay. So, I mean, given that, could you expound on that a bit? As you said, it's not just about adding numbers. It is about being smarter. How else can we be smarter in making use of our current capacity?
As I said, we select which ones go into a run. And the selection is really a process wherein the samples that are sent by the CESU, as well as the RESUs, the epidemiology surveillance unit across the region, they submitted to the DOH epidemiology and surveillance unit. So, and then the selection process happens, which ones need to go for sequencing because they satisfy any of the prioritization lists. In a country such as ours, where we have limited resources, as I said, we need to do this in a very smart way. And even countries outside of the Philippines, even the United States, they do have a fragmented sequencing system. So we really just need to be able to select the samples that go in a sequencing run, and we're prioritizing also like active cases. But sometimes we need to do some back tracing, which means we need to go back to some samples because they can provide us important information to understand a surge of cases or spike of cases.
Okay, maraming salamat po, Dr. Eva Maria Cutiongco-De La Paz, Executive Director of the UP National Institutes of Health.